35 to 52, you can have all kinds of symptoms. And if you go to a doctor who's not current on this, they'll put a Band-Aid on it. They'll give you a tranquilizer, they'll give you an antidepressant and send you away, but they're not treating the problem.
Or they'll tell you your levels are fine and you know you're not.
Exactly. Right. So that's why you can't go just by levels. So 35 to 52 is what we call perimenopause, and it's usually the area or the age of estrogen dominance, when you have too much estrogen in relation to your progesterone. Not that you have too much estrogen, because you usually don't. You just don't have enough progesterone, so you're out of balance.
Well, I just turned 50 and I haven't had a period for almost a year, and my symptoms are like the worst ever.
Okay, so you're postmenopausal if you have not had a period over a year. The average age is 52. I've seen some people, some women, and so it's Christian, in the late 30s who have gone through menopause. So you're a little bit early, but not a lot. So you're postmenopausal. Now, menopause is 12 months. 12 months without a period. And then there's the postmenopausal period, which lasts from once you pass those 12 months without a period, the rest of your life. Now, should you keep on hormones the entire life? Personal choice. Probably would want to stay on them to get through the transition. Say when the symptoms get really bad, we're using averages, 52s, the average age of menopause, say from 48 to 56, you might want to stay on them, and then you can get off. The benefits to staying on, you have cardiovascular protection, and that's why women live longer than men. You have protection from brittle bones, osteoporosis. You have a better lipid profile. Your cholesterol and your fat lipids are better if you stay on the hormones. So there's benefits to stay on them. And
you say your body produces a certain amount. Why you putting this stuff in here, is that going to affect what your body will produce?
No, because we're not.
It doesn't. No, it doesn't.
You have to stay on this for us all?
No. What happens postmenopausally, you have no more source of progesterone, so you have no progesterone. It's gone. So the only way you can get progesterone is if you supplement. Be a cream, a capsule, a trocheal lozenge, or whatever you use. Your adrenal glands still produce a little bit of estrogen, but not as much as you had premenopausal. Still produce a little bit of testosterone, but not as much as you had premenopausal. So we're going to supplement and attempt to bring that level back up to where it was premenopause when you were feeling pretty good. And our goal is to make you feel like you felt when you were feeling pretty good, maybe in your early 40s. That's the goal. Now, some people have better results than others. They're all individuals. It's different for everybody. But the fact that we're giving you a hormone is not going to shut down your natural production of hormones, because we're giving you a bioidentical hormone. We're not giving you something synthetic which can interfere with your natural production of hormones. But the body can't distinguish what we give you that's bioidentical to what it produces naturally. That receptor site sees the same chemical structure. It follows the body's normal metabolic pathways. It's identical. We're supplementing. We're not substituting. When you give something synthetic, you're substituting. So that's the big difference. When you substitute something, then it can clash with your natural hormones. Yes. And you can have a problem. Yes. When you're supplementing with something natural, it flows in with it. It goes down the same path and goes into the same hormone receptor sites, and you're not going to have a problem. There's no fight there.
Postmenopausal, many years, and if I can do something, it's going to, because a lot of these symptoms that she's having now, you have them even 10 years, 15 years after you've been postmenopausal. But if you can do something to supplement yourself, to feel better, to get rid of all this, no matter how much we exercise and how much you diet, you are going to lose that. And I think that it only helps. You know, you're not sleeping well at night. You don't want to take a sleeping pill. You don't want to start on this vicious cycle, I'm going to take a tranquilizer. So if you can do something, why not? men don't know all about this, but it'll give you something too, it's gonna help you.
Okay, you were next, and then you. Yes, ma'am.
My question to you is kind of,
Your question is?
my question is kind of touched on
Okay.
here. I'm like 36 years postmenopause.
Right.
Is it worth getting into all this?
Well, it depends. It's a personal choice. If you have symptoms that you want to alleviate, yes, but you have the other benefits that I told you about. Helps you with brittle bones, osteopenia, helps you with osteoporosis, helps you with your lipid profile, your cholesterol profile, can help prevent heart disease. Yeah, there's benefits. It's your choice.